He's had 56 since May the 6th, 2009. We've increased seizure medication 8 times and cataplexy medication once. Are these seizures a part of NPC? What can we do for it? Well, I guess there are a few questions in there. The first one is, these are then seizures. Sometimes it can be very difficult to tell if episodes are seizures or some other involuntary movement. And if you're in a situation like this, where clearly it's not possible to control in a conventional way, and there are a couple of questions. One is, if you think clinically they're seizures, is something making them worse? And it comes back to what we actually discussed yesterday, and I discussed a little earlier today. Is something else going on? Is the child very constipated? Is there an infection you don't know about? Is the child having reflux? Has the child got a bad sleep disturbance? Because any of these things will make seizures worse, and in fact most movement disorders will be worse in this situation. If the seizures haven't been clearly diagnosed before, then to make a diagnosis you can do an EEG, and if that shows a pattern of epileptiform discharges that are consistent with what you see clinically, most people will be comfortable making the diagnosis. If the manifestations are a little bit unusual, sometimes what you will want to do is prolonged EEG monitoring to capture the spells so that you know whether or not these are truly seizures, because the gold standard is to demonstrate characteristic abnormal electrical discharges at the time of the spell. That's the gold standard for deciding if something is a seizure. You don't always need to do that, but that's the gold standard. Because then the question would arise, if indeed these are seizures and you've been able to manage the confounding factors, you pushed one drug to the limit of tolerance, then it probably means that drug isn't going to work and you need to try something else. And the selection of drugs is empiric. In other words, it's just based on experience. We know a little bit about the way some of these drugs work. We actually know less about the way the new drugs work than the older ones. And it really comes down to a matter of trial and error, essentially, or some educated guessing, I might say. This sounds a little more than cataplexy, because the description is that there's a tightening up and shaking and falling. Cataplexy is a part of what's called the narcoleptic tetrad. Narcolepsy is sudden, overwhelming sleepiness, and it represents sudden onset of REM sleep. Normally when you go to sleep at night, you fall into slow wave sleep. You have cycles through the night. REM sleep is when you dream, and when you're dreaming, your body is paralyzed except for your jaw muscles and your eyes. Well, little fragments of REM sleep can occur at inappropriate times, so that if you get a strong emotional stimulus, you might feel weak at the knees, your head might drop, or you might collapse to the ground with very loose muscle tone. That's called cataplexy. And gelastic cataplexy, a sudden loss of muscle tone that's induced by something that the child thinks is funny, you may not find it funny, but the child thinks it's funny, can cause cataplexy. That usually is fairly well treated with tricyclic drugs like protriptyline or imipramine, clomipramine. Not always the case. So I would suspect these are more likely to be seizures than cataplexy, because there's a stiffening, because cataplexy is a sudden loss of muscle tone. In fact, we know in the Niemann-Pick disease type C that the very specific cells in the deep part of the brain called the diencephalon are affected by this disease because of what's seen under the microscope, and because the chemical that they produce, which is called hypocretin or orexin, different labs gave it different names, is low in the cerebrospinal fluid. And sleep is also disturbed, so children and adults may have what's called sleep inversion, where they tend to wake up at night, during the night, early morning, and then sleep during the day. And that's a huge problem. I don't need to tell families